Let's start with it. This starts us with our most conceptual topic in microbiology, that is systemic bacteriology. If you understand this well, your general microbiology numerous concepts will also be much clearer. So let's start with systemic bacteriology, and in this we'll start with our first topic, that is gram-positive cocci. Let us start. Let us start with gram-positive cocci. The minute we talk about gram-positive cocci, you already know that all cocci are gram-positive. You know that, except meningococci and gonococci. Except Neisseria meningitidis and gonococci, all cocci are gram-positive. So when we talk of gram-positive cocci, two main organisms come to my mind, that is staph and strep. Now, I can divide the gram-positive cocci on the basis of Catalase test. We are making a flowchart. On the basis of Catalase test, we can divide them into Catalase positive versus Catalase negative gram-positive cocci. Staphylococcus being Catalase positive, Staphylococcus being Catalase positive versus Streptococcus being Catalase negative. So on the basis of Catalase test, we can divide the gram-positive cocci into Catalase positive, that is staph, versus Catalase negative, Streptococcus. What is Catalase test? In Catalase test, we just add 3% H2O2. 3% H2O2 is added to culture colonies. It is added to culture colonies, and we want to see the presence of bubbles of nascent oxygen. We want to see the bubbles of nascent oxygen. Staph is Catalase positive. See, this is what it looks like. I'll go back to the theory part also, but this is the Catalase test. This is Catalase test. We added 3% H2O2 to the culture colonies, and we are just looking at bubbles of nascent oxygen. So Catalase positive, that is staph, versus Catalase negative, that is Streptococcus, that is strep. Next point, let us start with staph. Staphylococcus, on the basis of Coagulase test, is further divided into Coagulase positive, that is the pathogenic staph. Coagulase positive, which is pathogenic staph, that is staph aureus, versus Coagulase negative, versus Coagulase negative. Coagulase negative, in short, is also written as cons. Coagulase negative staph, which is the non-pathogenic staph. Coagulase negative staph, cons, which is the non-pathogenic staph. This non-pathogenic staph, on the basis of novobiocin sensitivity testing, is divided into novobiocin sensitive. We'll just see what we mean by novobiocin testing. Novobiocin is an antibiotic sensitivity test. Novobiocin sensitive means the organism is sensitive to novobiocin. So it is an antibiotic. So around the novobiocin disc, nothing will grow. Versus novobiocin resistant. That is, the organism will grow around novobiocin disc also. Novobiocin sensitive being staph epidermidis, versus novobiocin resistant being staph saprophyticus. Now, I'll be very impressed, especially those of you who have read medicine, I'll be very impressed if you can tell me what is the significance of novobiocin sensitive staph epidermidis. In CVS, we studied vegetative endocarditis. We will be doing this in medicine. There are 4 vegetative endocarditis: RHD, rheumatic heart disease; infective endocarditis; NBTE, non-bacterial thrombotic endocarditis; and Liebman-Sack endocarditis. Staph epidermidis is associated with prosthetic heart valves in infective endocarditis. It is associated with prosthetic heart valves. That means somebody got a prosthetic heart valve, leading to development of infection within the initial 1 year. Which is the most common organism associated? Cons, Coagulase negative staph. And which cons? Staph epidermidis. This is the master table of gram-positive Staphylococcus. We divided gram-positive organisms on the basis of catalase test into catalase positive negative. Staph was catalase positive, strep is catalase negative. On the basis of Coagulase test, I am not interested in telling you at all that Coagulase test can be performed by two methods. This Coagulase test, it can be performed by two methods. That is slide Coagulase test, which detects bound coagulase. It detects bound coagulase versus tube Coagulase test. Tube Coagulase test, which detects extracellular free coagulase. Not important at all. Totally not important. On the basis of Coagulase test, we can divide staph into Coagulase positive, that is the pathogenic staph, Staph aureus, versus Coagulase negative cons. Coagulase negative staph, the non-pathogenic staph. Have a look at our Coagulase test. This is a slide Coagulase test. As you are clearly able to make out, this is negative. There is no clumping. Versus here, clumps are forming. So this is Coagulase positive. Pathogenic staph. This is Staph aureus, pathogenic staph. Same thing can be seen in a tube Coagulase test also. In a tube Coagulase test, a clot will form. So this is the clot. Which is forming. This is Coagulase positive. Now, after Coagulase, we had a look at Novobiocin sensitivity testing. Cons, Coagulase negative staph, on the basis of Novobiocin sensitivity testing. Is divided into Novobiocin sensitive, that is Staph epidermidis. देखो बच्चे, have a look at this. This is an antibiotic sensitivity testing disc. This is antibiotic sensitivity testing. First point, which is the culture medium used? All these are the MCQs. All the points that we will be discussing in systemic bacteriology are either the questions which have already been asked or are the prospective questions. First question, and recent PYQ, the culture medium used is MHA, that is Muller-Hinton agar. For antibiotic sensitivity testing, we use MHA, Muller-Hinton agar. What happens in this is, see, this is the Kirby-Bohr disc diffusion method. This is the Kirby-Bohr disc diffusion method. What does this mean? देखो बच्चे, you are able to appreciate the presence of this antibiotic disc. This disc has antibiotic in it. The Muller-Hinton agar, on that the organism is growing. Now you are clearly able to see that around the antibiotic disc, the organism did not grow. This is called as zone of inhibition, ZOI, zone of inhibition. That is, organism is inhibited. Zone of inhibition, the organism is inhibited. That means the organism is sensitive. Around the disc, if the organism is not growing, that means zone of inhibition is present. So this is sensitive or resistant? This is sensitive. The organism is sensitive to Novobiocin versus the second case in which zone of inhibition is absent. The organism is fully growing till up to the disc. That means there is no zone of inhibition. The organism is resistant. This is antibiotic sensitivity testing based on Kirby-Board disc diffusion method. Around the disc, the antibiotic is diffusing. Next point, culture medium used, MHA, Muller-Hinton agar, MHA. So this is the master table. This is the master table of gram-positive Staphylococcus. Let us start. Let us start with our first main pathogenic staph, that is Staph aureus. So this starts us with our main topic in Staphylococcus, Staph aureus. You already know it is a gram-positive cocci, which is catalase positive. It is catalase positive, coagulase positive. You know that. On gram staining, again you know it is gram positive. That means it shows the presence of violet colored colonies, and staph means they are present in aggregates. They are violet grape-like clusters. They are violet grape-like clusters on gram staining, and this is what it looks like. Have a look on the gram stain now. These are all the grape-like clusters. These are the violet grape-like clusters, which are obviously violet in color, so gram-positive Staphylococcus. Next point. On nutrient agar, it shows the presence of golden yellow pigmentation. On nutrient agar, it shows golden yellow pigmentation. Unfortunately, has to be remembered, and these all are the classical images associated. देखो बच्चे, the minute I see this image, I'm able to make out कि बिल्कुल golden yellow है. This is golden yellow in color. It shows the presence of golden yellow pigmentation. Next, on blood agar, it is associated with beta hemolysis. On blood agar, it has beta hemolysis. Blood agar, we will see it with Streptococcus, has three types of hemolysis: alpha, beta, gamma. Alpha hemolysis is no hemolysis. Alpha is partial hemolysis. Beta hemolysis is complete hemolysis. Gamma is no hemolysis. So there are three types of hemolysis: alpha, beta, gamma. Staphylococcus on blood agar shows beta hemolysis, that is complete hemolysis, showing the presence of pinhead colonies. Again, bache, this is important. There are two types of colonies: pinpoint and pinhead. Dekho, there is a safety pin, na? Pin with head on it. Pinhead colonies means colonies are slightly bigger in size. Have a look at this. This is the complete hemolysis, beta hemolysis. Around the colonies there is complete hemolysis, and the colonies are bigger in size. That is, these are the pinhead colonies associated with Staphylococcus. Pinhead. Just for your reference sake, have a look at this image now. I guess we'll see it with the Streptococcus only. I do not have it in this PPT. This is the last one. No, I do. Have a look at the types of hemolysis. There are three types of hemolysis. Alpha hemolysis is partial hemolysis. This is partial. See, we are streaking the organism. You are able to make out these streaks around which there is partial hemolysis. Beta hemolysis is complete hemolysis versus gamma, which is no hemolysis. These are the types of hemolysis on blood agar. Both Staphylococcus and Strep we will be classifying it also, but Staphylococcus shows the presence of beta hemolysis with bigger colonies, with pinhead colonies, with presence of pinhead colonies. Next point, on MSA, that is on mannitol salt agar. On MSA stands for mannitol salt agar. The mannitol salt agar usually is pink in color. It becomes yellow. It changes its color from pink to yellow. So I can safely say that mannitol salt agar is the best selective medium for Staph aureus. It is the best selective medium for Staph aureus. I'm totally not interested in telling you that the best selective medium is MSA, mannitol salt agar, followed by Ludlam's agar, followed by Ludlam's medium. Not important, not interested. Main point was that the best selective medium is mannitol salt agar. Do not say it as blood agar, because even streptococcus grows on blood agar, not only staph. So best selective medium, mannitol salt agar. Next point. This gets us to the virulence factors associated with Staph aureus. Virulence factors associated. What increases the infectivity? What increases the virulence of Staph aureus? Virulence factors associated with staph. Staph is a capsulated organism. It has a capsule. Capsule inhibits phagocytosis. You know that. Next, it is associated with presence of teichoic acid. Staph is associated with teichoic acid. Please put a star. Teichoic acid is the major antigenic determinant. This is a recent PYQ only. Teichoic acid, bache, it is the major antigenic determinant of all strains. It is the major antigenic determinant of all strains. Antigenic determinants with both staph and strep are asked. For Staphylococcus, the major antigenic determinant is teichoic acid, which is absent. This teichoic acid, it is absent in cons. Which cons? That is staph epidermidis. It is absent in staph epidermidis. Next, the next virulence factor is protein A. Next virulence factor is protein A. देखो, first was capsule. Capsule inhibits phagocytosis. Antigenic determinant, teichoic acid. Next is protein A. Protein A, it also inhibits phagocytosis. That is, it is antiphagocytic. It is antiphagocytic. It is a cell wall component which inhibits complement pathways also. Which inhibits complement pathways also. They inhibit complement. So it is also a virulence factor. It is increasing the infectivity of Staphylococcus. Protein A. And lastly is the presence of hemolysis. Very, very important. Lastly is the presence of hemolysis. Hemolysis, which they are of two main types, alpha and beta hemolysis. Hemolysis, let us first start with alpha hemolysin. Hemolysins are of two types, alpha hemolysins, leave 2-3 lines below this, and beta hemolysins. Alpha and beta hemolysins. Beta hemolysin is also called as sphingomyelinase. It is also called as sphingomyelinase. So there are two types of hemolysins, alpha and beta. They are causing hemolysis. Alpha hemolysins, the point to be noted here, alpha hemolysins shows paradoxical action. This is again asked. It shows paradoxical action. Meaning alpha hemolysins, what is the paradox in this? Normally when we are heating a substance, more we heat, better sterilization will occur. But alpha hemolysins are paradoxical. They are inactivated at 60 degrees. They are inactivated at 60 degrees but become reactivated at 100 degrees. So they are paradoxical. Nobody will ask you why this happens. I'm just verbally saying it, I'll not write it for you. What happens at 60 degrees is that toxin binds with antitoxin at 60 degrees. So they become inactivated. But when we further heat it to 100 degrees, the antitoxin is released, leading to the free effect of toxin. Doesn't matter. They show paradoxical action. That is alpha hemolysis versus beta hemolysis. Beta hemolysis, also called as sphingomyelinase, which shows hot and cold phenomena. It shows hot and cold. It shows hot and cold phenomena. Acha, before we even go further, when we talk that hemolysis is associated with beta hemolysis, which hemolysis occurs with Staph aureus? Complete hemolysis. Remember, it is associated with beta hemolysis, complete hemolysis. Beta hemolysis show hot and cold phenomena, meaning it beta hemolysis starts at 37 degrees. It starts at 37 degrees, but is better seen is better seen at 4 degrees Celsius. It shows hot and cold phenomena. So these are the virulence factors associated with staphylococci. There were 4 main virulence factors. It had the presence of a capsule. Capsule, you as such know, prevents phagocytosis. Next, teichoic acid, which was the major antigenic determinant. Protein A, not important. Main points were teichoic acid and hemolysis. Hemolysis were of 2 types, alpha and beta hemolysis. Alpha hemolysis had a paradoxical effect versus beta hemolysis, which show hot and cold phenomena. These are the virulence factors associated. Next point. This gets us to toxin-mediated illnesses, associated with Staph aureus. Again, पूछा जाता है, the toxin-mediated illnesses. Whenever we talk of toxin-mediated illnesses, 3 main toxin-mediated illnesses come to my mind. The first, of course, is food poisoning. Staph aureus is associated with food poisoning. It is associated with food poisoning. Now, the incubation period being 1 to 6 hours. The incubation period being 1 to 6 hours. That means food poisoning occurs 1 to 6 hours after the intake of contaminated food. This 1 to 6 hour incubation period, it is the same as Bacillus cereus emetic strains also. बच्चे पूछा जाता है, nothing else is asked with Bacillus cereus emetic strains except the incubation period. So food poisoning, the incubation period of Staph aureus as well as Bacillus cereus, the one associated with vomiting, emetic strains, is the same as 1 to 6 hours. Next, now what is the difference between the two? Clinically, how will you differentiate? See, the best is culture. But clinically, how will you differentiate whether it is Staph aureus or Bacillus cereus emetic strains? Staph aureus food poisoning is because of contaminated milk and meat. It is because of contaminated milk, that is paneer, of course, and meat, versus Bacillus cereus emetic strains. So let me just write it as Bacillus emetic, where food poisoning is because of contaminated Chinese food, that is roadside fried rice and all. So the clinical history that will be given to you is, in a marriage setup, a family went to marriage 1 to 6 hours, after which there is development of food poisoning. What will we suspect? अब marriage में हम लोग पनीर and meat ज़्यादा खाते हैं ना, पनीर is expensive and free का मिल रहा है, free का खाना खाने में as such मज़ा अलग है. So in a marriage setup, food poisoning occurring after 1 to 6 hours is Staph aureus, versus a couple on a romantic date having roadside Chinese food is Bacillus emetic. First point. So this is how, all jokes apart, this is how the classical clinical history is also given with Staph aureus versus emetic. The next toxin-mediated illness is staphylococcal skin scalded syndrome, 4S. That is staphylococcal skin scalded syndrome. Staphylococcal skin scalded syndrome. The 4S. The skin is getting scalded. Scalded means the skin is getting exfoliated. So this occurs because of exfoliative toxins. This occurs because of exfoliative toxins A and B. Exfoliative toxins A and B. The fancy names of which the skin is getting scalded, the skin is getting exfoliated. So what is the dermatological name associated in adults? In adults, it is called as TEN, that is toxin epidermolytic necrolysis. That is toxic epidermolytic necrolysis. It is called as TEN. Versus in children, where it is called as Ritter's syndrome. So our first toxin-mediated illness was food poisoning. Next is staphylococcal skin scalded syndrome. And lastly, it is Staph aureus, which it is also associated with toxic shock syndrome. Now, toxic shock syndrome, this is extremely rare. Firstly, what is happening in toxic shock syndrome? Think of it yourself. A patient got Staphylococcus aureus infection and he went into a toxic shock. Toxic shock is associated with very high mortality. So, but mainly this occurs because of contaminated vaginal tampons. Because of contaminated vaginal tampons during menstruation. So this of course is not common now. This is not common. So it is due to contaminated vaginal tampons. Of course, not seen, not common, toxic shock syndrome. The toxic shock syndrome, why did that staphylococcal infection led to toxic shock throughout the body? Because this toxic shock syndrome toxin, TSS toxin, acts as a superantigen. This acts as a superantigen. Superantigen means it is causing non-specific activation of B and T cells in the body, leading to cytokine storm, release of massive cytokine storm. Toxic shock syndrome toxin. It is a superantigen leading to shock-like symptoms throughout the body. First class. So these are the illnesses associated with, or these are the toxin-mediated illnesses. Food poisoning, SSSS, that is staphylococcal skin scalded syndrome, and toxic shock syndrome. These are the illnesses associated. And lastly, this gets us to lab diagnosis of staphylococcus. This gets us to the lab diagnosis of staphylococcus. First is, of course, we need the specimen. I need to check whether infection is present or not. First thing, of course, I need a specimen. It can be pus from a suppurative lesion. It can be sputum in case of respiratory tract infections. It can be blood. If we are using in cases of fever or septicemia. In cases of fever or septicemia, it can be blood, for which we use the blood culture bottles. Next, in case of urinary tract infections, it can be urine. In urine, we use which sample? The first voided sample is okay in the morning. We use the initial start of the stream, midstream or end stream sample, which is midstream. In urine, in cases of UTIs, urinary tract infections, we use midstream sample. or the sample can be stools or feces in case of food poisoning. So of course, the first thing to make a diagnosis, what we need is a sample, the specimen. We can see it under direct microscopy. That is by the use of gram stain. It is gram positive cocci present in clusters. Next, we can culture it. On nutrient agar. That is the golden yellow colonies, or blood agar, where it shows the presence of beta hemolytic, that is complete hemolytic pinhead colonies. Next, we can also have a look at biochemical mechanisms. This is just a recap. We have done all this. The biochemical reactions associated with staph, that is, it is catalase and coagulase positive. Catalase and coagulase positive. You knew till this point. Next method to make a diagnosis, please put a star, is bacteriophage typing. Next batch is bacteriophage typing. This is asked as a simple written MCQ. Bacteriophage typing in Staphylococcus. Bacteriophage typing is used for epidemiological purposes. It is used for epidemiological purposes to detect the source of infection. For epidemiological purposes, to detect source of infection. Bacteriophage typing for epidemiological purposes. A simple, straightforward written MCQ. And lastly, how will therapy be started? For starting therapy, either we can give antibiotics as such, or better is by antibiotic susceptibility testing. Which is the culture medium used for antibiotic susceptibility testing? Antibiotic susceptibility testing. Which is the culture medium used? You know this? MHA. We use Muller-Hinton agar. MHA, Muller-Hinton agar, the Kirby-Boer disc diffusion method. There was presence of an antibiotic disc in the center. If zone of inhibition is present, that means the antibiotic is sensitive. The organism is sensitive to that antibiotic, versus if zone of inhibition is absent, the organism is resistant. First class. So this was our first main gram positive cocci, Staphylococcus. So bache, this takes care of staph.